The internal view, the orange is the petrous part of temporal bone, which houses the inner ear, and the pink is the internal acoustic meatus, which the vestibular cochlear nerve, facial nerve, and labyrinth nerve pass through. And the green tab is the sphenoid bone. This is a superior orbital fissure, and what passes through there is a lacrimal nerve, frontal nerve, abducens nerve, inferior division of oculomotor nerve, trochlear nerve, superior division of ocular motor nerve, and nasociliary nerve. The green tab is the lesser wing, the pink tab is the greater wing, the orange tab is the optical canal, which the optic nerve and the ophthalmic artery pass through this opening. Then the red dot right in the middle is a sella turcica, which the pituitary gland sits there. The green paper is identifying the crista galli, which is actually the little red line in the middle. This attaches to the outermost covering of the brain, and it helps secure the brain to the cranial cavity. Surrounding the crista galli is a cribriform plate. This has little tiny holes that allow the olfactory nerves to pass from the smell receptors into the nasal cavity to the brain. And now to review sutures. This would be the coronal suture right here. It's where the parietal meets frontal bone anteriorly. Then there's a sagittal suture right here, where parietal bones meet superiorly at the cranial midline. And there's a lambdoid down here, where parietal bone meet occipital bone posteriorly. Then there's a squamous, which would be in this area right here, where parietal and temporal bone meet on the lateral aspect of the skull. How about I tell you? Maxilla and alveolar process is the upper jaw. Then the alveolar process is the teeth. Nasal, it's right here. Zygomatic would be right here. And the two bones that form the zygomatic arch are squamous part and the zygomatic process. Ethmoid is in here, the inner corner. The vomer is the in here, the bottom. And the two bones that form the bony nasal septum are the vomer and the perpendicular plate, which is right above of the ethmoid bone above the vomer, which is right here. The inferior nasal concha is down here, and that this forms part of the lateral walls of the nasal cavity. Then we have the mandible, and the parts of the mandible are the body, which is here, the angle, which is here, the ramus, which is this back corner, the mandibular condyle up here, mandibular notch, and the coronoid process right next to it. This is the vertebral column. There are 4 curves, which is the cervical, thoracic, lumbar, and sacral. For the cervical vertebrae, there are 7 bones or vertebrae. The first one would be the atlas, which articulates to the occipital condyle. In the thoracic vertebrae, we have 12 vertebrae. There's a spinous process. The transverse process, intervertebral foramen, and the body, which is in the back. And the position of the intervertebral discs are in between each vertebrae. Okay, the lumbar vertebrae is down here, and there are 5 vertebrae. The sacrum has 5 vertebrae down here, and these are all fused. The coccyx is way down here, and these are four tiny fused vertebrae. Then we have the sternum in the front, which is this bone right here. This is the jugular notch way at the top. This little square piece is the manubrium. This is the body, and this is the xiphoid process. Okay, so these are the ribs. The first 7 are the true ribs. So there's 1, 2, 3, 4, 5, 6, 7. Then the false ribs, or the vertebral chondral ribs, 8 through 12. 1, 2, 3, 4, okay, 12. And then there are the floating ribs, which are these two right here. The ribs articulate with the vertebrae by 2 facets. One joins the body, the other articulates with the body of the vertebra immediately superior. And the ribs have a head, which is way at the front here. They have a neck, which goes a little below that, and a tubercle, which is around this area right here. Actually, it's in the back. So it's the head, the neck, and tubercle.